Hello, my name is Princess, and I'd just like to begin by acknowledging the traditional owners of the land on which we meet today. I would also like to pay my respects to elders past and present. Within this video, we'll be talking about the regional Aboriginal and Torres Strait Islander people, the disparity in health status and life expectancy of Aboriginal and Torres Strait Islander people in Dubbo, focusing on the healthcare issue of cardiovascular disease. Jake and I will be talking about the links between culture and health. Alessandra will be talking about the social determinants of health of Aboriginal and Torres Strait Islander people that impact on cardiovascular disease. And Connor will be talking about the application to culturally safe nursing practice. Here. I'll be discussing the connection to country and collective society perspective.
The spiritual connection between Aboriginal and Torres Strait Islander people and their country is critical and strongly relates to their health and well-being. They have unique beliefs on healthcare that strongly correlates to the connection to country. Their conception of health is based on a holistic approach, which includes connective elements such as spiritual, ideological, social, environmental, physical, economic, and mental. It is very important to understand that when the harmonies of these connective elements are disrupted, Aboriginal ill health will continue. Country is a multidimensional element because it consists of people, plants, animals, dreamings, earth, soils, minerals, and waters. People would talk about country similarly as to how they would talk about a person, as they would speak, sing, visit, worry, feel, sorry, and long for their country. There are many different ways Aboriginal people connect with the country, such as being present in their country, stories, dances, and songs that are related to a place or an object. For example, a tree or an activity such as hunting. This particular feeling of connection preserves the holistic connection of body, mind, and spirit, which is health and well-being. The detachment from the land and culture is what is opposite of well-being and health. According to Willis, Pierce, and Jenkins, 2004, they showed an example of how health and country are intertwined. Aboriginal people who are from the region of Murray River demonstrated how poor mental and physical health related to poor health of the Murray River. Aboriginal people were not able to pass on significant traditional knowledge about the Murray River because of legal restricted access and environmental degradation. Deprivation from the land impacted negatively on the knowledge of health and well-being.
And I'll be talking about the connection with health services and their perspective of health and illness. The cultural belief of Aboriginal and Torres Strait Islander people heavily influences their choices in health services and their perspective towards health and illness. Aboriginal and Torres Strait Islander people believe that health is not just the physical well-being of an individual, but refers to the social, emotional, and cultural well-being of the whole community, in which individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community. Traditional spiritual healing of the Aboriginal and Torres Strait Islander community cannot be given by those not of the culture or heritage. Therefore, there has been issues regarding a lack in integration of Western and traditional medicines and partnership with Aboriginal traditional healers. In response, the Aboriginal Community-controlled Aboriginal Health Services (ACCHS) have set up among 143 locations over Australia to deliver holistic and culturally appropriate healthcare and primary care services. The ACCHS is a government-funded organization that allows the Aboriginal and Torres Strait Islander community engage in health services in accordance with protocols or procedures appropriate to the community. The ACCHS has been able to provide services such as 24-hour emergency care, immunization, home visits, and pharmaceutical supply system. Healthcare professionals within the ACCHS have all taken part in Aboriginal health worker and cross-cultural orientation programs to provide culturally appropriate care. In essence, traditional healers and elders are vital in providing health services to Aboriginal and Torres Strait Islander people, as they do not only provide spiritual healing of individual, but also delivers care with the utilization of a culturally appropriate and holistic approach.
I'll be identifying and explaining the relevant Aboriginal and Torres Strait Islander social determinants of health, other than culture, that impact cardiovascular diseases. Diet and food availability. A social determinant of health that impacts cardiovascular diseases, or CVD, is diet and food availability. Diet and food availability is a relevant social determinant of health that directly impacts CVD. One of the main contributors to CVD is an inadequate or imbalanced nutritional intake. According to Pettigrew, Jongelis, Moore, and Pratt, as a result of limited diet and healthy food choices in Dubbo, cardiovascular diseases has been identified as a leading contributor to Indigenous Australian deaths. Diet and food availability has shown to be directly correlated with CVD. The lack of access and ignorance to the importance of good nutrition has left regional communities such as Dubbo with a high CVD mortality rate and lifestyle choices that threaten the next generation with the same fate. Aboriginal Indigenous Health Infinite research shows that there has been 331 avoidable deaths in 2004 among Indigenous people, which is 3.6 times that of their non-Indigenous counterparts. Sedimentary lifestyles. As well as a poor diet, another social determinant of health that impacts cardiovascular diseases is a sedimentary lifestyle. A sedimentary lifestyle is one characterized by one lacking in regular exercise and is important in maintaining and developing lean muscle mass, burning calories, and reducing body fat and blood pressure. Aboriginal Indigenous Health Infinite research has shown that the correlation between poor lifestyle choices, including a sedimentary lifestyle, and its contribution to CVD, its lack of regular exercise, is particularly linked to a heart failure and stroke. The people most likely at risk of being inactive are Indigenous females and older people. In 2008, only about one third of 15-year-olds or older Indigenous people have confirmed that they partook in a form of physical activity in the last year. Indigenous people are more likely to have a sedentary lifestyle than non-Indigenous people. In 2004 to 2005, there were about 1.6 times more inactive. However, the 45 to 64 years age groups were twice as likely to be inactive and at a higher risk of CVD. Access to appropriate health care. A social determinant of health that impacts cardiovascular disease is access to health care. Healthcare, in terms of Aboriginal and Torres Strait Islander people, may not only refer to conventional healthcare providers, but also traditional healers. Creative Spirits explains how traditional Aboriginal healing methods have been used for many years. It is characterized by targeted healing of the spirit, focusing on the natural vibrations of the body, often assisted by a traditional balm derived from plants with healthy vibrations. Aboriginal Indigenous Health Infinite has acknowledged the relationship between psychosocial and physical health. For some Indigenous individuals, it is not enough to access modern health providers only, and poor spiritual health and identity may lead to increased risky behavior such as drinking and smoking or drug abuse and stress. Social determinants of health that impact cardiovascular diseases in regional areas include a poor diet and food availability, sedentary lifestyles, and access to appropriate health care. The statistics and information gathered are indicative of the disparity facing the Indigenous community in regional communities such as Dubbo in relation to cardiovascular health. In order to combat CVD or cardiovascular diseases, it is imperative to reflect on each social determinant to begin working on solutions on reducing the impact of CVD in indigenous communities.
Alright, so I've got the question, consider the disparity in health status and life expectancy in Aboriginal and Torres Strait Islanders in regional areas due to cardiovascular disease. And so basically, disparity is just the great difference between two variables. So when we consider the disparity in health status and life expectancy in Aboriginal and Torres Strait Islanders compared to other Australian cultures and ethnic group, there's a great difference. In 2010 to 2012, non-Indigenous Australian males had a life expectancy of 79.7 years, while Indigenous Aboriginal Australians had a life expectancy of 69.1 years. That's a gap of 10.6 years. Non-Indigenous Australian females had a life expectancy of 83.2 years, whilst Indigenous females had a life expectancy of 73.7 years, a gap of 9.5 years. The disparity in health and life expectancy is believed to exist because of several factors, including disease prevalence and incidence, health behaviours caused by smoking, drinking and similar activities, social determinants of health including education gap, unemployment, income, healthcare services access and equity. We use the example of Dubbo, a regional city located in Australia, to demonstrate this, where there's an estimated life expectancy of 17 years less in Indigenous groups than non-Indigenous groups. So the Indigenous groups in Dubbo have a 60-year life expectancy, while the female Indigenous groups have a 65.1 year life expectancy. Cardiovascular disease accounted for 32.6% of mortalities in Indigenous Australia groups in Dubbo. compared to the national statistic of 25% of Indigenous Australian death being due to cardiovascular disease in 2009 to 2013 period. To close the gap in disparity in health status and life expectancy due to cardiovascular disease in Aboriginal and Torres Strait Islander communities, regional areas such as Dubbo have implemented various health strategies, programs and establishments with readily access to the community. Thummo Aboriginal Medical Co-op is an Aboriginal health service based in Dubbo, established to restore Indigenous groups access to higher quality, cultural appropriate primary health care in Dubbo, which is delivered by Aboriginal health services from the region, has been our first priority. This was said by Miss Sandra Bailey, who is the CEO of the AH and MRSC. Other programs and strategies introduced in this area include increased health professional workers, hiring of Aboriginal workers to meet specific needs in cultural competency and safe way, youth groups, nutrition vans established to promote health, increased transport access to and from the health facilities to allow for ready access and information for all groups. As a registered nurse in Australia, you are required to practice in a culturally competent and culturally safe manner. To do this, nurses and midwives need to not only understand but respect other cultures, to provide holistic care to them in a way which acknowledges their beliefs and meets their needs. To deliver culturally competent care to the Aboriginal and Torres Strait Islander groups in Australia and in regional areas, I would first learn about their culture. Education is key, and without it, you're unable to provide culturally safe and competent care. Inquiring questions from both others who have lived in the same community as the Indigenous community and members of the community about their lifestyle, health issue and concern to gain knowledge. After doing so, I would work with other healthcare professionals to provide extensive care inside the health facility, which are directly suited to meet their cultural needs and provide them with comfort. However, healthcare is not the only in-facility service but a lifestyle. I provide information on health and how to live a healthier lifestyle outside of the health facility, whilst providing them with the means to readily access healthcare services and information again if needed. Racial discrimination is well documented as a contributing factor to poor health outcomes for Aboriginal and Torres Strait Islanders, according to the MBA. And by performing culturally competent and safe care as a registered nurse, the disparity in health status and life expectancy in Aboriginal and Torres Strait Islanders will begin to close.
To summarize our assignment, we have investigated, learned about Aboriginal and Torres Strait Islander culture and practices to appropriately provide patient-centered care in the healthcare workplace. We have done this in collaboration between Aboriginal and Torres Strait Islander health workers and other healthcare professionals. Open to alternative therapies in health medicine, meaning we have included Aboriginal and Torres Strait Islander ways of healing. We have included this in our professional work practice.